Joining us on Can Do FM today, we have Tracey York-Andrews, who is an optometrist based in Ulverston. Welcome to Can Do FM, Tracey.
Thank you, Andrea. Thank you so much for having me today.
Now, eye health. You know, we're all quite used to regular trips to the dentist. You know, these are the sorts of things which were instilled in us as children. But we should also be watching out for our eye health, shouldn't we? And making regular trips to the optician. Why is that so important?
Well, it's really important because the majority of sight loss can be avoidable. So sight loss can be due to refractive errors, which can be sorted out by wearing the right prescription. And a lot of cataracts can be sorted and treated. Early glaucoma can be treated. Macular degen and diabetic retinopathy could maybe be reduced or avoided in some cases just by changing lifestyle choices. But there are things that we pick up in
right. You've given a big list of horrible sounding diseases there, only a couple of which I've heard of, but some of these are life-changing illnesses, aren't they?
Absolutely. Things like glaucoma, if it's picked up early, it's so easy to treat. But if it's left so that what glaucoma is really increased pressure in the eye, and what it does is it cuts off the nerve supply and the blood supply to the eye. So once that nerve supply is gone, there is nothing we can do to restore it. It's gone. Whereas if the glaucoma is picked up early, it's so easy to treat just by using eye drops.
Gosh, that's such a simple thing to solve. To lose your eyesight because of that's incredible. Yeah,
absolutely. And what we also do is we do an amazing retinal scan. So not all optometrists have this. We've got a piece of equipment called the Optomap. Now, Optomap is absolutely incredible. It saves lives. It saves vision. I got it when I was back in about 2012, 2013. I went in search for a retinal camera because so many people use retinal cameras. And I found this piece of equipment, which there's nothing else like it on the market. So a retinal camera will check about 40 degrees of the retina in one view, which is quite limited. So there's a lot of guesswork involved in what's going on the rest of the retina. Optomap does a retinal scan, so it doesn't just take a photograph, it scans 200 degrees of the retina. So we can actually see what is going on. And the magnificent thing about Optomap is we're looking directly into the tissue of the body without cutting anything open. So anything that affects the whole body will show up in the eyes. So we can pick up things like diabetes. But also, as I said, it's life-saving. It saved a number of lives in my practice. One of those was a young girl who came in for a routine test, no symptoms at all, and she had pressure on the brain. So I was able to do a referral and her life was saved through that amazing piece of equipment. But she's not the only one. There's a number of stories of people whose lives have been saved in my practice through that amazing piece of equipment. It's also so easy to see things like retinal tears, retinal detachments that could be missed when you're just checking that tiny little section in the center. Right. So amazing equipment that we've got nowadays. And as I say, not everybody's got that piece of equipment. We're one of the few that have it in Cumbria.
Right. Really interesting. And so important. Preventative medicine, really, isn't it? Preventative therapy.
Yeah, there is so much that can be prevented. Even with macular degen and diabetes, there's easy things that you can do to help slow down, reduce, maybe even prevent them. Macular degen, one of the big causes of macular degen is smoking.
Right.
So if you're in a smoke-free environment, you reduce your risk of getting macular degen.
Let's take a break there, listen to some music, and then we'll come back and talk a little bit more about the practicalities of visiting your optometrist. My guest this afternoon on the afternoon show is Tracey York-Andrews, an optometrist based in Ulverston. We've been talking, Tracey, about the importance of regular eye tests. And you know, it's well documented that so many easily treated diseases and conditions, if you pick them up early enough, that you can sort them. And it's usually your optometrist that will do that for you. So in that case, then, how often would you say we should be visiting?
You should be visiting. Every one of us should be visiting the optometrist at least once every 2 years. Why? Because it's so important to pick up issues. The NHS does pay for a number of sight tests. Those are for children under the age of 16. They pay once a year. Why? Because children's vision can change quite rapidly. Right. When they go through growth phases, one of the things that comes up a lot nowadays in children is short-sightedness. I mean, they're stuck on the computer for hours and hours. With lockdown, how much time have they spent on the computer?
I always get confused between short-sightedness and long-sightedness. What's the one where you can see far away but you can't see close to?
The one that you can see far away is far-sightedness. The one where you can see close by is near-sightedness. So that makes it a bit easier.
The one that as you get older and we all start fumbling about for our glasses, that's
called presbyopia. Now, that's quite exciting because it happens to most people around about the age of 40 it starts. And what happens is that the lens in the eye starts to lose flexibility. So I can joke and say, oh, we can give you an arm extension. No, we can't. We can't give you an arm extension, but we can give you reading glasses. And it just happens to so many people. It's not worth struggling. I know, being in the supermarket and you're trying to read those labels, goodness me, it's absolutely impossible without the reading glasses.
And you have to go through that sort of initial adjustment, don't you, of they've made this writing so much smaller, and then it's like, no, it's me, actually.
Well, the complaints about the color. Goodness me, why are they making the labels the printing so small and the colors so bad? Yeah, I agree. Why are they? But the best thing to do in those situations is pop into your local optometrist, have an eye test and get it sorted. Because what happens is from the age of 40 to the age of 60, the lens in the eye continues to lose flexibility. So we expect your reading prescription to increase every 2 years.
Right. But however, people are hesitant about going to see their optometrist. We've just talked about some of the diseases that you can have. Perhaps people are concerned that you're going to tell them something that they don't want to hear, like you shouldn't be driving, which may limit somebody's freedom, or just down to the cost of new glasses. I mean, I wear contact lenses, I have done for years. I'm well aware of the cost of a new pair of specs. You can get up into the £500 or more quite easily. What would you say to people who are hesitant?
I agree with you there, Andrea, 100%, that people are hesitant sometimes to come to the optometrist. Maybe they're fearful of medical appointments, and we try and make it as comfortable as possible. We try and make it as friendly as an environment as possible. Being an independent practice, we can do that, and people just pop in and say hi. We've got good rapport with our patients. We've got that lovely professional environment, but it is very personalized. So there are things that keep them away, and that could be price. You're 100% right. It costs money to have an eye test. Well, the NHS does pay for some sight tests, like low-income groups, patients over 40 who have a family history of glaucoma, because it's really important for those people to have regular sight tests in case they have glaucoma. So price is a major concern. In our practice, I don't know what other practices do, we have price ranges to cope with everybody's needs and wants. So we, as an independent practice, we source from various suppliers so that we can provide good quality lenses at low cost prices in case price is a factor. We have low cost frames, and we also have designer frames because everybody has different needs. So yeah, cost could be a huge factor, and you're 100% correct. Some people don't want to come in case we pick up something wrong in their eyes, in case we maybe pick up diabetes, in case we maybe pick up a retinal detachment. But those patients that have had retinal detachments know that something's wrong. They come in already aware that something could be horribly wrong. And that's why it's so important to come in so that the retina can be attached. It needs to be attached normally the same day. So it's really important that we get that chance to make those urgent referrals. And then you're 100% right. There's limitations sometimes on things like driving. So patients might not come in because they're scared that we're going to say, you can't drive anymore.
Mm.
And there
I
are.
mean, especially in this sort of region, you know, where a lot of people live in quite isolated villages, you know, there's been a huge reduction in public transport over the past few years. To take away somebody's right to drive, you know, you in some cases you're limiting them to the village that they live in.
Absolutely. And the only option is really a taxi. So to do your grocery shopping by taxi is really, really difficult. And the problem is with the people that are losing their eyes. That's the sad part about optometry. I love just restoring vision to people. I love it when they put on their glasses and say, wow, I can see the leaves on the trees. That's the real rewarding side of optometry. But sometimes when patients are losing their vision, there are times where we can do lots by improving their vision, by giving them up-to-date glasses, by doing referrals for cataract surgery. There's so much we can do, but occasionally, like with macular degen, we might not be able to improve the central vision. It depends on whether it's wet or dry macular degen as to the treatment methods. But yeah, if patients are losing their central vision and they can't drive, well, it's for the safety of everybody that they don't drive. But I still get amazed by patients that I've seen that are losing their vision, and yet that doesn't stop them from achieving incredible things, achieving things that I wouldn't even strive to achieve. So yeah, some patients just take the wind out of my sails because they go above and beyond, not with trying to drive when they can't drive, but achieving
different things,
mountains and just doing amazing things.
Well, tell us where you're based, Tracey.
I'm based at the Spectacle Lounge, York-Andrews Spectacle Lounge in Ulverston. It's opposite Costa, between Costa and Boots. So you can find us there. We've been serving the community. We started in Ulverston in 2013 under a different name, and we bought a practice at 19 Market Street, outgrew it really rapidly, and moved to 34 Market Street in 2015 when I bought the building there and did it up. But the practice has grown and grown, and we're glad to be back as a team to serve the community. It's just such a lovely place to be. Very welcoming. So anybody that wants to contact us, can I give the telephone number?
Go on then, quickly.
Okay. 01229 480000.
Thank you. Right, so just remember, folks, there are other optometrists available in the local area. If you have not been get your eyes tested in the past couple of years, then it's time to make an appointment. Off you go. Thanks for joining us this afternoon, Tracey. It's been great to talk to you. Really interesting.
Thank you, Andrea. Have a lovely day.